Alright, we are still in Unit 1. We're in Chapter 3, still looking at some practice problems on how to interpret graphs. I'm looking at some frequency tables and how to interpret that with some of the data as well. But it says here, most patients in this example, and again, pause the video, write some of these problems down so you can see it. The charts are more important. This is just like background information more than anything anyway. But most patients who undergo surgery make routine recoveries and are discharged as planned. Others suffer excessive bleeding, infections, stuff with post-surgery before they're discharged, right? And then it delays them. Suppose your city has a major hospital and a small hospital, each performing major or minor surgeries, and you collect data to see how many surgical patients have their discharges delayed by post-surgical complications, and you find the results shown in this table. So, simple table here. You have your discharge from a large hospital versus small hospital. Major surgery, small surgery. It says 120 of the total of 800, 50 out of 10 out of 50, 10 out of 200, 20 out of 250, and so on. So it says overall, all right, for what percent of patients was discharge delayed? All right, so we're looking for discharge delays. So we're looking at percentages. Okay, so taking a look at this, basically as I'm looking at this, it says then 130 out of 1,000 down this way, 30 out of 300, right this way, same deal. So I'm just getting the percentages. So the point is I can keep this going across. So this is 160 out of 1,300, or about 12.3% of patients had a delayed discharge, right? They're total discharged, right? Whether it's a small hospital or a big hospital, the delays were right here for a total of 160 delays, right? Taking a look at this. Part B wanted to know, were the percentages different for major versus minor surgeries? So were they different for major versus minor? Yeah, they were definitely different, right? Major surgery patients were delayed, right? Major surgery patients were delayed 130 out of 85 for about 15%, while the minor surgeries were 30 out of 450, which is 6.7% of the time. So there seems to be a pretty big difference that a minor surgery, there isn't going to be as much delay as the major surgery. And then part C says, overall, what were the discharge delay rates at each hospital? So we want to know them at each hospital now, right? Well, each hospital, right, down there is 130 out of 1,000. So the large hospital, about 13% of people are delayed versus the 10% here. The small hospital has the lower overall rate of delayed discharge. D, what were the delay rates at each hospital for each kind of surgery? So they want to know each specific kind of surgery, right? We can delay. So it says large hospital, major surgery. Just take them and divide. And then the large hospital for minor surgery, take them and divide. Small hospital. Point is you can look at each of them differently, each individual one. And you can see that even though small hospitals have a lower overall rate, right, of discharge, it looks like for major surgeries, 20% of the time they're staying, which that's not very good if you think about it. So that would scare me a little bit. So it's showing you that overall the data and versus subgroups of data can be largely impacted when you do it. And then scrolling back here to this one, the small hospital advertises that it has a lower rate of post-surgical complications, and it does, but we just went over, if I separate it down, but for bigger procedures it has a larger rate. And that kind of makes sense what we're getting at here. So yeah, that makes sense. It does, but while the overall rate delays discharge is lower, it is overall, the large hospital did better with both different on a smaller scale of surgeries. It's just because they have more surgeries that come in, it looks like this one does better, only as a 10% delay versus 13% delay. But the point is, individually, especially the large one, that's not good. Like if you're having a large surgery for your delays. So the small hospital performs a higher percentage of minor surgeries, right? Doesn't have as many of those minor and major surgeries. It has more minor surgeries, but not as many large by any stretch. Overall, 200 of the large hospitals, 1,000 are dealing with minor surgeries, which isn't even that much in the first place. Minor surgery had a lower delay rate for them. So that's one reason. The real truth is found by looking at the rates after the information is broken down, which is often the truth about most data. Looking at it in a more larger scheme versus breaking it down, you can see that data can be contorted and moved and morphed to how you want it to look. Something for you guys to think about in the future. So that's the idea of what we call Simpson's paradox. So can you design a Simpson's paradox? Two companies are vying for the city's Best Local Employer Award to be given to a company most committed to hiring local residents. And although both employers hired 300 new people in the past year, Company A brags that it deserves the award because 70% of its new jobs went to local residents, compared to the other, Company B's 60%. Company B concedes that those percentages are correct, but points out that most of its new jobs were full-time, while most of Company A's were part-time. Not only that, says Company B, but a higher percentage of its full-time jobs went to local residents than that, and the same was true for part-time jobs. Thus, Company B argues it's a better local company, again, because they split it down into smaller subgroups, right? So how it's possible for Company B to fill a higher percentage of both full-time and part-time jobs with local residents, even though Company A hired more. All right. So your answers can vary with this, but the point is, full-time employees, depending on how they want to separate it. This is just that idea of Simpson's paradox, and you working backwards with it to figure it out. But you could set up a table to show, because it said overall this one is 70%, so it's greater than that, right? But you're trying to show that out of that, this is greater and this is greater. So this is one option that could possibly happen. It's just one way that you could fill them all out to say, hey, look, this is better and this is better. So it's better in every separate avenue than that one, is all. So this is one way. You could have done it, changed the numbers in a different way. They just wanted you to fill out a table that shows, hey, look, overall, yeah, it looks like you're hiring more local people than I am, but actually when you split it up into part-time and full-time, I'm doing a better job with both categories than you. So just in their benefit. All right, so those were all the examples, just to kind of give you some more so you can see how to work some of these those tables and stuff in Unit 1, Chapter 3. And if you have any questions, please don't hesitate to let me know.